Hi everyone! Welcome back to a new episode of English Mini Talks channel. We're so happy to have you here with us today.
Hi guys, hope you're all doing great. It honestly feels amazing to be back and talking to you again.
Yeah, seriously. We're super excited about today's episode and can't wait to dive in.
Before we get started, make sure you're comfortable, maybe grab a coffee, and enjoy the conversation with us.
And if you like what you hear, don't forget to hit that like button and subscribe to the channel.
Yes, please hit like and subscribe. It really helps us out a lot and lets us know you're enjoying the content. Thank you.
So today we're diving into something that we all experience, but maybe don't talk about enough in English: healthcare conversations. You know, those interactions we have with doctors, nurses, and other medical professionals.
Oh my gosh, yes. And honestly, I have to admit, going to the doctor used to make me so nervous, especially when I was younger. Not just because of the medical stuff, but because I was always worried about not knowing the right words to explain how I was feeling.
I totally get that. I remember one time I had this terrible headache for days, and when I finally went to see a doctor, I kept saying, "My head hurts really bad," over and over again. I didn't know words like throbbing or migraine or how to describe if the pain was sharp or dull.
Exactly. And then there's all that paperwork they give you at the beginning. Medical history, allergies, symptoms. It can be overwhelming when English isn't your first language, or even when it is, but you're not familiar with medical terminology.
But you know what? Over the years, I've realized that healthcare professionals are usually really patient and understanding. They're used to helping people communicate about their health, and they want to understand what's going on with you.
That's so true. And I've also learned that it's totally okay to ask them to repeat something or explain it in simpler terms. They'd rather make sure you understand than have you leave confused.
Definitely. So today, we thought it would be super helpful to listen to some real-life conversations between patients and healthcare providers. We've got dialogues with nurses, doctors, and we'll explore different scenarios you might encounter.
And as always, we'll break down the key vocabulary before each conversation, and afterwards we'll chat about what happened and share some interesting facts or tips related to each situation.
Perfect. So whether you're preparing for a doctor's visit, studying English, or you're a healthcare professional yourself, we hope these conversations will be useful and interesting.
All right, let's get started. But first, let's go over some key vocabulary you'll hear in our first conversation.
So our first word is checkup. This is a routine medical examination to make sure everything is okay with your health, even when you're not sick.
Right. For example, I have my annual checkup next week with my family doctor.
Perfect. Next, we have blood pressure. This measures how hard your heart is pumping blood through your body.
Exactly. You might hear, the nurse will take your blood pressure before you see the doctor.
Our third word is symptoms. These are the signs or problems you feel when something might be wrong with your health.
A great example would be, my main symptoms are a sore throat and a runny nose.
Number 4, prescription. This is the written order from a doctor for medicine that you need.
Like, the doctor gave me a prescription for antibiotics to treat my infection.
And finally, allergic. This means your body has a bad reaction to certain foods, medicines, or substances.
For instance, I'm allergic to peanuts, so I have to be very careful about what I eat.
Awesome. Now let's listen to our first dialogue between Sarah, a patient, and Tom, a nurse practitioner.
Good morning, Sarah. Please have a seat. How are you feeling today?
Hi, Tom. I'm doing pretty well, thanks. Just here for my yearly checkup. I've been feeling mostly fine, but I wanted to ask you about a few things.
That's great that you're staying on top of your health. Let me start with some basic measurements. I'll need to check your blood pressure and weight first. Could you roll up your sleeve for me?
Of course. I've been a bit worried about my blood pressure lately. My mom has high blood pressure, and I've been feeling a bit dizzy sometimes.
I understand your concern, especially with the family history. Let's see what we get here. Okay, your reading is 118/75, which is actually excellent. Completely normal range.
Oh, that's such a relief. But what about the dizziness? It usually happens when I stand up quickly from sitting or lying down.
That sounds like it could be orthostatic hypotension. Basically, your blood pressure drops temporarily when you change positions quickly. It's pretty common and usually not serious. Do you drink enough water throughout the day?
Probably not as much as I should. I maybe have 2 or 3 glasses a day.
That might be part of it. You should aim for about 8 glasses daily. Now let me check your heart rate and listen to your breathing. Any other symptoms you've noticed recently?
Well, I've been having trouble sleeping lately. I fall asleep fine, but I wake up around 3 a.m. and can't get back to sleep. It's been going on for about 2 months now.
That must be frustrating. Are you feeling stressed about anything in particular? Work, family, any major changes in your life?
Actually, yes. I started a new job 3 months ago, and it's been pretty demanding. I love it, but I think I'm more anxious than usual.
That makes sense. New job stress can definitely affect sleep patterns. Are you doing anything to manage the stress? Exercise, relaxation techniques?
I used to go to yoga classes twice a week, but I stopped when I started the new job. I just haven't had time.
I'd really recommend getting back into that routine if possible. Even 20 to 30 minutes of exercise can make a huge difference for both stress and sleep quality. Now, let me ask about your medications. Are you currently taking anything regularly?
Just my daily multivitamin and occasionally ibuprofen for headaches. Oh, and I should mention, I'm allergic to penicillin. I know that's important for medical records.
Absolutely, thanks for mentioning that. I'll make sure that's noted in your file. How often are you getting these headaches?
Maybe once or twice a week. They're not severe, just annoying. Usually after long days at work.
Those could be tension headaches from stress. Along with getting back to exercise, make sure you're taking regular breaks from the computer and staying hydrated. If they get worse or more frequent, definitely let us know.
That makes sense. So overall, how am I looking health-wise?
You're looking great. Your vital signs are all normal, and the issues you're experiencing seem to be manageable with some lifestyle adjustments. I'd like to see you back in 6 months or sooner if the sleep problems persist or worsen.
Perfect. Thank you so much, Tom. I feel much better knowing everything checks out okay.
Wow, that was such a realistic conversation. I really liked how Tom made Sarah feel comfortable right from the start.
Absolutely. Did you notice how he validated her concerns? When Sarah mentioned being worried about her blood pressure because of her family history, Tom didn't dismiss it. He said, "I understand your concern," and then checked it properly.
That's an important point, and I love how Sarah was so prepared. She brought up her family history, mentioned her symptoms clearly, and even remembered to tell Tom about her penicillin allergy without being asked.
Yes, that's actually a great tip for anyone going to the doctor. Always mention your allergies even if they don't ask. It's crucial information for your safety.
Something interesting I noticed was when Tom explained orthostatic hypotension. He used the medical term, but then immediately explained it in simple language. Your blood pressure drops when you change positions quickly.
That's a perfect example of good healthcare communication. Medical professionals often do that. They'll use the proper medical term so you can look it up later or understand it if you hear it again, but then explain it in everyday language.
And can we talk about the connection between stress and physical symptoms? Sarah's sleep problems and headaches were both linked to her new job stress.
That's so common. Stress really does manifest physically in our bodies. It's fascinating how Tom connected the dots. New job 3 months ago, sleep problems for 2 months. Our bodies often react to stress before our minds fully process it.
Here's a fun fact. Did you know that tension headaches are actually the most common type of headache? They affect about 70% of people at some point, and they're often triggered by stress, poor posture, or dehydration.
Speaking of dehydration, I was impressed that Tom asked about Sarah's water intake. Most people don't realize that even mild dehydration can cause dizziness, headaches, and fatigue.
Right. The 8 glasses a day rule is actually more like a guideline than a strict rule, but it's a good starting point. Your water needs depend on your activity level, climate, and overall health.
One thing I really appreciated was how Tom gave practical, achievable advice. He didn't overwhelm Sarah with a huge list of changes. Just drink more water, get back to yoga, take computer breaks.
Exactly. And he was realistic about it too. He suggested 20 to 30 minutes of exercise, not some impossible workout routine. Small, sustainable changes are usually more effective than dramatic ones.
Before we move on to our next dialogue, let's quickly review those vocabulary words we heard in action. Checkup, blood pressure, symptoms, prescription, and allergic. Did you catch them all?
Perfect. And remember, if you're ever in a similar situation, don't be afraid to ask questions or ask your healthcare provider to explain something in simpler terms. They want you to understand.
All right, let's move on to our second conversation. But first, let's learn some new vocabulary.
Our first word is appointment. This is a scheduled meeting with a healthcare professional at a specific time.
For example, I need to make an appointment with my dentist for next month.
Next up is insurance. This is coverage that helps pay for your medical expenses.
Like, does my insurance cover this type of treatment?
Third word, referral. This is when one doctor sends you to see a specialist for additional care.
Here's an example. My family doctor gave me a referral to see a cardiologist.
Number 4 is diagnosis. This is the medical professional's conclusion about what health condition you have.
You might hear, the doctor's diagnosis was pneumonia, so she prescribed antibiotics.
And finally, treatment. This refers to the medical care or therapy used to help cure or manage a health problem.
For instance, the treatment for my broken arm included a cast and physical therapy.
Excellent. Now let's listen to our second dialogue between Dr. Martinez and her patient, James.
Good afternoon, James. Please come in and have a seat. I see from your appointment notes that you've been having some concerning symptoms. Can you tell me what's been going on?
Hi, Dr. Martinez. Thanks for seeing me on such short notice. I've been feeling really tired for the past 3 weeks, more than usual. And I've been getting these weird chest pains, especially when I climb stairs or walk quickly.
I'm glad you came in to get this checked out. Chest pain should never be ignored. Can you describe the pain for me? Is it sharp, dull, burning, or pressure-like?
It's more like pressure, like someone is squeezing my chest. It doesn't last long, maybe 30 seconds to a minute, but it's definitely noticeable, and it goes away when I rest.
That's very helpful information. Have you experienced any other symptoms? Shortness of breath, dizziness, nausea, or pain in your arms or jaw?
Now that you mention it, yes. I've been getting a bit short of breath, especially when the chest pressure happens. No dizziness or nausea, though.
Okay, James. Based on what you're describing, I want to run some tests to rule out any heart-related issues. Your symptoms could indicate several things, but I want to be thorough. Do you have any family history of heart disease?
Actually, yes. My father had a heart attack when he was 52, and my grandfather had heart problems too. Should I be worried?
Family history is definitely a risk factor we need to consider, but try not to worry too much right now. We're going to figure out what's going on. I'm going to order an EKG, some blood work, and I think we should do a stress test as well.
What exactly is a stress test? I've heard of it, but I'm not sure what it involves.
A stress test monitors your heart while you exercise, usually on a treadmill. It helps us see how your heart responds to physical activity. It's completely safe and will give us valuable information.
That sounds reasonable. How long will it take to get all these results back?
The EKG we can do right now. It only takes a few minutes. The blood work results should be back within 24 to 48 hours, and we can schedule your stress test for later this week. Does your insurance cover cardiac testing?
I believe so, but I'll need to check with them. What happens if the test shows something concerning?
If we find anything that needs attention, I'll refer you to a cardiologist. That's a heart specialist. They can provide more specialized treatment if necessary. But let's take this one step at a time.
I appreciate that approach. What should I do in the meantime? Should I avoid exercise or any activities?
For now, avoid strenuous exercise until we get your test results. Light activities like walking are fine, but if you experience chest pain, stop immediately and rest. If the pain becomes severe or doesn't go away with rest, go to the emergency room right away.
Understood. I feel better having a plan. When should I follow up with you?
Let's schedule you for next week once we have all your results. We'll review everything together and decide on the best course of treatment based on our findings.
Wow, that conversation had a completely different tone from our first one, didn't it? Much more serious, but Dr. Martinez handled it so professionally.
Absolutely. I was really impressed with how she balanced being thorough and cautious without causing James to panic. When he asked if he should be worried about his family history, she acknowledged it as a risk factor, but told him not to worry too much.
That's such a delicate balance that doctors have to maintain. And did you notice how she asked very specific questions about the chest pain? Sharp, dull, burning, or pressure-like, those details really matter for diagnosis.
Yes, and James did a great job describing his symptoms too. He was specific about the duration, 30 seconds to a minute, and mentioned that it goes away with rest. That kind of detail is super helpful for doctors.
Here's something interesting. The symptoms James described, chest pressure during exertion that goes away with rest, plus shortness of breath, those are classic signs that doctors look for when evaluating heart problems.
That's fascinating. And I loved how Dr. Martinez explained the stress test when James asked about it. She didn't just say, "We need to do a stress test." She explained what it involves and reassured him it was safe.
Communication is so important in healthcare. Speaking of which, did you catch how she gave him clear instructions for what to do while waiting for results? Light activities okay, but stop if there's pain, and go to the ER if it gets severe.
Exactly. That's such practical advice. And she was realistic about the insurance question, too. She didn't just assume it would be covered. Healthcare costs are a real concern for many people.
Here's a fun fact. EKGs, or electrocardiograms, have been around since 1903. They measure the electrical activity of your heart and can detect irregular rhythms, previous heart attacks, and other heart problems.
That's amazing. And the whole process is completely painless. They just put sticky electrodes on your chest and it takes about 5 to 10 minutes. No needles or anything invasive.
I also appreciated how Dr. Martinez mentioned the possibility of a referral to a cardiologist. She was preparing James for next steps without making it sound scary. Just, if we need more specialized care, here's what happens.
That's so important. Referrals aren't necessarily bad news. Sometimes you just need someone with specific expertise. It's like getting a second opinion from a specialist.
One thing that stood out to me was how James felt comfortable asking questions. What exactly is a stress test? And what should I do in the meantime? Those are perfect examples of being an active participant in your healthcare.
Absolutely. Never be afraid to ask your doctor to explain something. If you don't understand a test, procedure, or instruction, it's your right to get clarification.
And let's not forget our vocabulary words from this dialogue: appointment, insurance, referral, diagnosis, and treatment. These are really essential words for navigating healthcare in English.
So true. Whether you're scheduling an appointment, asking about insurance coverage, or understanding your treatment plan, these words come up constantly in medical settings.
All right, let's move on to our final dialogue for today. Let's start with our vocabulary.
Our first word is medication. This refers to any drug or medicine prescribed by a doctor to treat a condition.
Here's an example. I need to take my medication twice a day with food.
Next is side effects. These are unwanted reactions or problems that can happen when you take medication.
Like, the side effects of this antibiotic might include nausea or dizziness.
Third word, dosage. This is the amount of medication you should take and how often you should take it.
For example, the dosage for this pain reliever is 2 tablets every 6 hours.
Number 4 is follow-up. This means returning to see your healthcare provider to check on your progress or condition.
You might hear, let's schedule a follow-up appointment in 2 weeks to see how you're feeling.
And finally, recovery. This is the process of getting better or returning to normal health after an illness or injury.
For instance, her recovery from surgery went very smoothly, and she was back to work in 3 weeks.
Excellent. Now, let's listen to our final dialogue between Dr. Johnson and her patient, Ashley.
Good morning, Ashley. How are you feeling today? It's been 2 weeks since we started your treatment for bronchitis.
Hi, Dr. Johnson. I'm feeling so much better, thank you. The cough is almost completely gone, and I can finally sleep through the night again.
That's wonderful to hear. I'm glad the antibiotics worked well for you. How did you tolerate the medication? Any side effects that you noticed?
Actually, yes. For the first few days, I felt a bit nauseous, especially in the mornings. But I started taking the pills with breakfast like you suggested, and that really helped.
Perfect. That's exactly the right approach. Nausea is a common side effect with that particular antibiotic, but taking it with food usually solves the problem. Did you finish the entire course of medication?
Yes, I made sure to take all of them, even after I started feeling better. I remembered what you said about completing the full dosage to prevent the infection from coming back.
Excellent. That's so important, and I'm really glad you followed through. Many people stop taking antibiotics once they feel better, but that can lead to antibiotic resistance or the infection returning stronger.
Actually, I had a question about that. Why is it so important to finish all the antibiotics? I was curious about the science behind it.
Great question. When you don't complete the full course, some bacteria might survive, usually the strongest ones. These survivors can multiply and become resistant to that antibiotic, making future infections harder to treat.
That makes perfect sense. I never really understood that before. Now, I do have another concern. Ever since I got sick, I've been worried about my immune system. Is there anything I can do to strengthen it?
Your concern is understandable, especially after being sick. The good news is that your recovery has been excellent, which actually shows your immune system is working well. But there are definitely things you can do to support it.
I'd love to hear your recommendations. I've been reading online, but there's so much conflicting information out there.
I understand the confusion. Let me give you some evidence-based advice. First, focus on getting adequate sleep. Aim for 7 to 9 hours per night. Sleep is crucial for immune function.
I've been trying to do that. What about diet and exercise?
Both are very important. Eat plenty of fruits and vegetables for vitamins and antioxidants. Regular moderate exercise, even just 30 minutes of walking daily, can boost your immune system. But avoid over-exercising, as that can actually weaken it temporarily.
That's really helpful. What about supplements? Should I be taking vitamin C or zinc or anything like that?
If you're eating a balanced diet, You probably don't need supplements. However, vitamin D can be beneficial, especially during winter months when we get less sunlight. But I'd recommend getting your vitamin D levels checked first.
That sounds reasonable. Should we do that test today or wait for my next visit?
We can add it to today's lab work if you'd like. I also want to do a quick follow-up chest examination to make sure your lungs are completely clear.
Absolutely, let's do both. And when should I come back for my next follow-up?
Given how well your recovery is going, I think we can wait 3 months for your next routine visit. But call me if you develop any respiratory symptoms or if you have any concerns before then.
Perfect. I feel so much more confident about managing my health now. Thank you for taking the time to explain everything so clearly.
You're very welcome, Ashley. You've been an excellent patient, asking good questions and following the treatment plan perfectly. That's the key to successful recovery.
What a perfect way to end today's episode. That conversation between Dr. Johnson and Ashley was so educational and positive.
I loved how Ashley was such an engaged patient. She asked about the science behind finishing antibiotics, wanted to understand how to boost her immune system, and even questioned the conflicting information she found online.
Yes, there's so much health information on the internet, and not all of it is reliable. It's always best to ask your healthcare provider about what you read online.
Exactly. And Dr. Johnson gave evidence-based advice. She didn't just say, eat healthy. She gave specific recommendations like 7 to 9 hours of sleep, 30 minutes of walking daily, and getting vitamin D levels checked before taking supplements.
I was really impressed with her explanation about antibiotic resistance, too. She made it so clear why you need to finish the entire course, because the strongest bacteria survive if you don't, and they can become resistant.
That's one of those things that sounds obvious once you understand it, but many people don't realize the science behind it. Education like that can literally save lives by preventing antibiotic-resistant infections.
And can we talk about how Ashley handled the side effects? She experienced nausea, but found a solution by taking the medication with food, just like the doctor suggested.
That's a great reminder that side effects don't always mean you have to stop taking medication. Often there are simple solutions, like taking pills with food at different times or with plenty of water.
Before we wrap up, let's do a quick review of all the vocabulary we learned today. From our first dialogue, checkup, blood pressure, symptoms, prescription, and allergic.
From our second dialogue, appointment, insurance, referral, diagnosis, and treatment.
And from our final dialogue, medication, side effects, dosage, follow-up, and recovery.
That's 15 essential healthcare vocabulary words. If you want to practice using them, try describing a recent doctor's visit using as many of these words as possible.
Great idea. And remember, don't be afraid to ask questions during your medical appointments. All 3 of our patients today, Sarah, James, and Ashley, asked thoughtful questions and got better care because of it.
Absolutely. Healthcare is a partnership between you and your provider. The more you communicate, the better your care will be.
So, that wraps up today's episode. We hope these conversations help you feel more confident in healthcare settings. Whether you're learning English or just want to improve your medical vocabulary.
If you found this episode helpful, please give it a thumbs up and subscribe to our channel for more English conversation practice.
And don't forget to hit that notification bell so you never miss our new episodes.